Welcome back to our channel. Today, we're diving into another USMLE Step 1 question to help you ace your exams. Let's get started with our first question. A 14-year-old boy is brought to the emergency department by his parents because of a 1-month history of intermittent right knee pain that has worsened during the past day. He rates his current pain as a 6 on a 10-point scale and says that it worsens when he walks and lessens when he sits. During the past 2 weeks, he has been walking 1 mile daily in preparation for participation in the school marching band. He has not taken any medications for his pain. He sustained a right tibia and fibula fracture at the age of 8 years after a skateboarding accident, which was treated with internal fixation and casting. He has asthma treated with inhaled budesonide daily and inhaled albuterol as needed. His mother has type 2 diabetes mellitus, and his maternal grandmother has osteoporosis. The patient is 170 centimeters tall and weighs 88 kilograms. BMI is 31 kilograms per square meter. Temperature is 37.0 degrees Celsius. Pulse is 95 per minute, and blood pressure is 130/80 millimeters of mercury. Physical examination shows hyperpigmented, thickened skin at the nape of the neck. There is tenderness to palpation of the anterior aspect of the right hip and limited range of motion on abduction, internal rotation, and flexion of the right hip. The left hip and knees are non-tender. Range of motion is full in all directions. The remainder of the examination discloses no abnormalities. Let's break down this question. First, we need to understand the patient's history and symptoms. We have a 14-year-old boy with intermittent knee pain, worsened by walking. There has been a recent increase in physical activity. He has a history of fracture in the same leg. There is a significant family medical history, with his mother having diabetes and his grandmother having osteoporosis. Current findings include obesity with a BMI of 31 and hyperpigmented skin, which is suggestive of insulin resistance. Now, let's analyze the options. Which of the following factors most increased his risk for developing this condition? The options are BMI, family history, medication use, previous fractures, and recent physical activity. This question requires us to identify the most significant risk factor contributing to his knee pain. Let's discuss each option. Option A, BMI. A BMI of 31 indicates obesity, which is a significant risk factor for joint problems due to increased mechanical stress and metabolic changes. Obesity is closely associated with conditions like slipped capital femoral epiphysis, or SCFE, which is likely given the patient's hip pain and limited range of motion. Option B, family history. Family history is important, especially for metabolic conditions like diabetes and osteoporosis. However, it's not the most immediate risk factor for his current knee pain. Option C, medication use. His asthma medications are not known to directly contribute to joint problems. Option D, previous fractures. While a history of fractures can affect joint health, it's less likely to be the most significant risk factor compared to his obesity. Option E, recent physical activity. Increased activity could exacerbate existing conditions but is not the primary risk factor. Therefore, the most significant risk factor in this case is his BMI. Obesity increases the likelihood of developing orthopedic issues such as SCFE, especially in adolescence. And that's how you dissect a USMLE Step 1 question. Remember, always consider the patient's overall health and risk factors. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more medical exam tips. See you next time.